Hello and welcome back, my friends. If you're new here, my name is Laura and I make videos about hypermobile Ehlers-Danlos syndrome to help educate, raise awareness, and share my experiences and advice living with this condition. Today I want to share my thoughts on Dr. Mike's 2 videos about EDS. If you don't know who Dr. Mike is, he's a practicing family medicine doctor as well as a famous YouTuber that makes medical-related videos. I've been subscribed to his channel for a couple years now, and his videos are educational as well as super entertaining and relatable, and I highly recommend checking him out if you haven't already. His 2 videos about EDS were uploaded about 2 years ago, and I've seen them both before, so this isn't a true reaction video, just my thoughts on them. Anyways, let's just play the first video.
Diseases doctors often miss. Episode 1. EDS, or Ehlers-Danlos syndrome, is a genetic condition that affects the connective tissues of the body, leading to hypermobile skin or joints.
So I first want to say that the man pictured stretching his skin over his mouth is Gary Turner, and he currently holds the world record for the most stretchy skin. That level of stretchiness is literally as extreme as it gets, and while stretchy skin can be a common feature of EDS, it isn't seen in everyone, and certainly not to this degree.
Because of the hypermobility, patients often present with repeated injuries, like dislocations, sprains, and even fractures. In fact, there are actually 13 subtypes, some of which can affect the skin, heart, blood vessels, and bones.
I'm glad that he mentioned there are currently 13 subtypes of EDS, since I feel like a lot of people, medical professionals included, think it's just one single disorder.
No cure is currently known, and patients who are diagnosed can be treated with a combination of physical therapy, medications, or surgery. Too often, patients with EDS are overlooked and treated as hypochondriacs, when the reality is this condition requires more attention and more recognition. Subscribe for episode number 2.
He's very right here. In fact, one study found that the median age of diagnosis is at 28 years old, and the average time from seeking help to an actual EDS diagnosis is 10 years. That's pretty significant considering EDS is a genetic disorder that you're born with. I think it's both overlooked and misdiagnosed because of a mix of lack of knowledge about the disorder among medical professionals and the fact that the symptoms are all over the place and seemingly unrelated to each other. For example, a person with EDS who doesn't know it might see a doctor for foot pain, but not think to mention that their joints hyperextend, that they bruise easily, have stretchy skin, have a lot of GI problems, get dizzy when they stand up, and have chronic pain elsewhere in their body. They're just there about their foot after all, and most doctors don't think to ask those questions. My hope is that EDS will become more well known among both patients and doctors so that the dots can be more easily connected. I can't remember where I heard this phrase, but it's very fitting. If you can't connect the issues, think connective tissues. Let's look at the second video.
When you hear hoofbeats, think horses, not zebras. This is a saying that's instilled in your mind as a medical student by your senior physicians. They tell you this over and over again when you're presenting your cases. Reason being, when you're a student and you're learning about these obscure diseases that you're being tested on that are very rare, it's normal for them to pop into your mind the first time you see a symptom that matches that illness. Well, you can't think like that as a practicing doctor. The way we're trained to do this is to create a differential diagnosis. This is a list of illnesses ranked in order from most probable to least probable, with the exception of a disease that can harm you now. For example, if you come into my office as a 21-year-old male complaining of some mid-sternal chest pain, I'm not going to assume you have a heart attack. It's not likely that you're having a heart attack, but I best rule it out because it can be life-threatening. All that being said, I admit that we in the medical community forget about our zebras. Our patients with these rare, chronic, incurable illnesses that go undiagnosed for decades at a time simply because we're thinking horses, not zebras. So today I want to cover 3 rare, chronic, incurable illnesses: PCOS, Ehlers-Danlos syndrome, and thyroid disease, in order to have an honest discussion about these patients who are truly suffering as a result of misdiagnosis.
When I first watched this video, I remember thinking, why is he including PCOS and thyroid disease in a video about rare disorders, because they're both actually very common. But he does go on to explain later in the video that while they're both quite common, they're still treated like zebra cases because they are still diagnosed pretty frequently.
Patient number 1 with your doctor. Patient number 3 is a 35-year-old male that comes in with a chief complaint of easy bruisability. The doctor does a good history and physical exam and wants to rule out bleeding disorders. Does a whole set of blood tests only to find out that they're all negative. So they reassure the patient. Patient goes home without an answer. What should have been asked are questions about hypermobile joints, accidents, loose skin, and family history. Why? Ehlers-Danlos syndrome. It's one of those zebras that we always have to keep in the back of our minds. EDS is a genetic condition that affects the connective tissues of our body. This can include skin, blood vessels, bone, and even organs.
Again, that's a video of someone with extremely stretchy skin, which is usually only seen to that degree in the classical and classical-like subtypes of EDS.
Now there's 13 different subtypes of EDS, but all of them have one thing in common, and that's hypermobility. It's really important when you're seeing these group of symptoms arise in a patient that you ask about hypermobility so it doesn't go overlooked.
Again, he mentioned that there are 13 subtypes of EDS, which was awesome, and that all 13 have hypermobility in common, also awesome. But that man in the video is another extreme example. Most people with EDS don't have that level of joint hypermobility.
In fact, there's currently no cure for Ehlers-Danlos syndrome, but we can focus on controlling the risk factors and helping patients reduce their symptoms of the disease. Currently, it's estimated that 1 in 5,000 individuals in the US will be diagnosed with EDS, and classically, it goes underdiagnosed. In order to make the diagnosis, we use a set of clinical criteria, genetic blood tests, imaging, and even skin biopsy at times to make sure that we are in fact treating the correct subtype of the disease. When we're talking about treatments, we're largely focusing on physical therapy, surgery to fix the injured joints, and finally drugs and medications that can help a patient with the symptoms of EDS. One of the most common misconceptions about EDS is that it must be inherited from your family. And while that is true for the majority of cases because it is usually transferred in an autosomal dominant or autosomal recessive nature, there are de novo, meaning new mutations that can happen spontaneously where you develop EDS without any of your family members ever being diagnosed.
I love that he mentioned de novo mutations, because a lot of people think that they can't have EDS if no one else in their family has it, which isn't true. It's also important to note that it's possible for many people within a family to not be diagnosed but actually have EDS simply because they either don't have enough concerning symptoms to warrant seeking answers, or they just haven't figured it out yet since it's so overlooked and misdiagnosed.
It's also important to keep in mind that there are other connective tissue disorders and hypermobility disorders that need to be ruled out before jumping to the diagnosis of EDS, but that is why it's really important that if you have hypermobile joints, elastic skin, or any of the symptoms I mentioned above, talk to your doctor, make sure that you're diagnosed correctly.
I'm glad he mentioned ruling out other connective tissue disorders because there are many out there that share a lot of symptoms with EDS, like Marfan and Lloyd-Dietz syndrome.
Do you know a zebra condition that I should be talking about? Drop it down below in the comments. And if you want more information on any of these illnesses that I talked about in today's video, links are down below to legitimate sources.
It's so helpful that he posted a good EDS resource in the description because that allows those who watched his video and are now thinking there's a possibility that they might have EDS to then click on the link and read in greater detail than what he went into in the video. I could easily pick apart his video and say that he didn't mention X, Y, or Z important bits about EDS, but his video's purpose wasn't to give an all-encompassing description of EDS, but to simply talk about it in a brief and easy-to-understand way to help bring more awareness about the condition. And I think that he did an absolutely fantastic job. So thanks, Dr. Mike, for the awesome video. I can't wait to see more like it. Do you have any videos that you would like me to review or react to? Let me know down in the comment section. If you thought this video was helpful, please click on the like button. If you want to see more videos like this, subscribe to my channel, and don't worry, it's completely free. If you click on the notification bell icon, you will be notified when I release new videos. As always, thanks for watching and see you next time.